Today we'll be discussing how to fix psychologically induced erectile dysfunction.
And if this is what you're looking for, please do stick around until the very end. We'll show you exactly how to get a free, personalized treatment plan to help reverse this condition. Hi, I'm Kelvin, and I'm one of the wellness professionals here at the Novus Center.
And I'm Stephanie Wolff, PA and CEO of the Novus Center. So we're going to discuss how important the brain is when it comes to having erections. So I want to explain it to you in complete detail so that you guys understand. It all starts with your senses. Senses being, what are you thinking about? What are you seeing? What are you touching? What are you smelling? Remember, your 5 senses. All of those 5 senses are going to trigger a dopamine and oxytocin release in the brain. Remember, dopamine is your feel-good hormone. It's kind of like your pleasure center. Oxytocin is the love center. So once those two have been activated, it's going to send a signal down your spinal cord with nitric oxide synthase. Nitric oxide synthase is actually an enzyme responsible for producing nitric oxide. And as you guys all know, nitric oxide is a potent vasodilator. This is what's actually causing your blood vessels to relax so that you can get optimum blood flow through these blood vessels. So now that you have the nitric oxide synthase traveling down your spinal cord, it's going to go to the penis. And once the penis has vibration or sensation, touch, again, senses, that will then stimulate your nitric oxide release within your blood vessels. It also stimulates something that's called acetylcholine. Acetylcholine is another neurotransmitter that's released in the brain, but it's only released when the penis has been vibration, touch, using senses. That acetylcholine is responsible for activating your autonomic nervous system. Autonomic nervous system is then divided into your parasympathetic and your sympathetic. We all learned about this in grade school. Your parasympathetic is what we like to call rest and digest. So when you're calm, you're watching TV, your heart rate is low, your blood vessels are dilated, you're calm. This is what you actually need to get an erection. Remember, I just said vasodilation, so it's causing your erection. But in order for you to actually ejaculate, you then need to activate your sympathetic system. The sympathetic system is your fight or flight. This is when the bear is chasing you and your heart is going fast and you have vasoconstriction. That's how ejaculation happens. So now that I just explained exactly how it is that you get an erection, think of all the moving parts and how everybody has to be communicating at the right moment. Again, it's another example of a symphony. Everybody has to be playing their instrument at the same time or when they're supposed to be playing it in order for that song to be beautiful. The same thing goes for the erections. If you've activated your sympathetic because maybe you have, anxiety or some kind of post-traumatic, how are you going to cause vasodilation? How are you going to get an erection? You can't. Or let's say you've now given yourself a Trimix injection. How are you activating your dopamine and your oxytocin? You aren't. You're just relying on a medication. So the brain is very important for your erections. There are a few different ways to treat psychologically induced erectile dysfunction, but the first and foremost is speaking with a sex therapist or just a licensed therapist in general. And here are some other options for you as well. Most doctors prescribe Viagra, or what you guys know as the little blue pill, or perhaps it's Levitra or Cialis. Whatever name it is, it's actually what they call a PDE5 inhibitor. And just to give you a little bit of background of what a PDE5 inhibitor is, it actually blocks what's called cGMP. I know I'm throwing out all kinds of words at you. cGMP is actually an enzyme that will cause calcium to be blocked from the cell. And when you have a flux of calcium in the cell, you get vasoconstriction. So no blood flow is flowing through it. So this is the body's natural process. You're going to release nitric oxide, which then releases something called cGMP. This cGMP is going to block calcium. That way you can have vasodilation. So what does PDE5 do? Well, the PDE5 enzyme itself is going to make sure you're not walking around with an erection for 24 hours a day. But as we get older, we produce less nitric oxide. When you produce less nitric oxide, that means that you're no longer creating that chemical reaction, which means that you're no longer blocking that calcium. So they had to invent Viagra and Levitra and Cialis, this PDE5 inhibitor, so that it can go in there and basically hold off that calcium. So you could sustain an erection much longer, or basically back to when you were 20. When you were 20, you were able to get an erection and maybe it lasts for, a couple hours. Maybe you had a short refractory time. But as you get older, you're no longer able to do that. So that's really why these PDE5 inhibitors were invented, so that you could actually sustain an erection for 4 to 6 hours. Then of course there's the Trimix injections. Trimix injections are basically a chemical compound, and they have 3 different types of chemicals in them, which are all vasodilators. So once you inject the Trimix, it literally takes 10 minutes and you have an erection. There's no thought process behind it. It just happens. It's a vasodilator. And then it lasts for about 4 to 6 hours. So, the gentlemen that do use Trimix, they are able to have multiple sessions or shorter refractory time if they want to, because the medication is doing the job for them. And then don't forget that there's surgery. Surgery is exactly what you're thinking. There is both a inflatable and then there's a semi-rigid contraption. And what they do is they actually will place it in between your corpus cavernosum. If it's an inflatable one, it's the best way for me to explain it is kind of like one of those balloons that you'll see, outside of a car dealership, and you're responsible for pumping it up when you're ready for it. Whereas a semi-rigid is basically like a prosthetic. So like it says, you're semi-rigid, but it's surgery. And then of course there's shockwave therapy. Shockwave therapy is using acoustic wave or sound waves. And what sound waves are known for is breaking up microplaque and promoting something that's called angiogenesis, which is the formation of new blood vessels. So now you're optimizing the amount of blood flow through these new blood vessels and feeding new tissue. Regeneration. Now with shockwave therapy, we both have in-clinic as well as an at-home using what's now called the Phoenix. If you'd like to learn a little bit more, you can go to getyourphoenix.com. Then of course, there's hormone balancing. So hormones play a huge role, no pun intended, in erections. And the reason why is because, I'm not sure if you know this, but as you get older, your testosterone starts to decline, just like my estrogen starts to decline. But what's most important about all of this is that testosterone is a potent vasodilator. It's responsible for creating your nitric oxide. So remember when I was just talking about the PDE5 inhibitors and why they were actually brought to the market? They were brought to the market because as you age, your testosterone starts to decline, which means your production of nitric oxide starts to decline, which means you don't have as much vasodilation as you used to. The other thing that testosterone does is it acts as a natural calcium channel blocker. Again, I know that you remember I talked about it in the PDE5 inhibitors. The more calcium you have in a cell, the more vasoconstriction you're going to have in your blood vessels. So as you age, remember, you're producing less testosterone, which means you're producing less nitric oxide, which means that you're holding on to more calcium. You're not getting rid of it so that you can have vasodilation. So that's what testosterone's going to do for you. But testosterone's not a one-stop shop. There's so many other hormones that need balancing in your body. Growth hormone, estradiol, dihydrotestosterone, DHEA. There's so many other players. The best way that I like to explain it is think about it like a symphony. You have all these different musicians creating this beautiful music. What happens if all the flute players call in sick? You no longer have the same song. It's the same thing with your body. Don't forget about the P-shot. So the P-shot is using your PRP, or platelet-rich plasma. This is your own blood. So you come into the clinic, we draw your blood, we spin it in a centrifuge, and we remove the platelet-rich plasma. Your platelet-rich plasma has all your growth factors, your own stem cells, and your healing properties, which really help to regenerate that tissue in the penis as well as the blood vessel formation. So we have a lot of gentlemen who come in here who do not only shockwave therapy, but they'll do the P-shot at their last treatment, and then of course, they deal with their hormones. But which of these treatments should you actually do? Maybe you don't have the time or the money to try all of these treatments. And maybe you shouldn't be trying all these treatments. So we have a solution just for you.
Novus is the nation's leading sexual wellness clinic. We have a 95% success rate with reversing erectile dysfunction, all due to our standard protocol in treating patients. For patients who have erectile dysfunction, we have 3 separate protocols. First of which is minimum protocol. Second is preferred protocol, and third is best protocol. If you want to skip ahead and check out your own personalized protocol, go to getmyprotocol.com.
Now we'll discuss the minimum protocol, the absolute minimum our patients need to reverse their psychologically induced erectile dysfunction.
The minimum protocol for psychological ED includes a Novus 90-minute hormone medical evaluation. Certain antidepressants or anti-anxiety medications can also have a number of side effects that can lead to a hormone deficiency and/or erectile dysfunction. So we must go over your medications and your supplements, your vitamins, your diet. If I can see your entire blood panel, which includes all of your hormone levels, your cholesterol, your sugar, your thyroid, your vitamins, then I'll know how to balance and optimize your hormones, which can help regenerate your tissue and blood vessels, as well as strengthen sexual function, libido, energy, and overall health.
Now, obviously we can't explain everything here at once, so if you want your own personalized treatment plan for your erectile dysfunction and an explanation on what to do and when to do it, go to getmyprotocol.com.
We've left the clinical studies to the topics we've discussed today in the description below. We hope this helps.